Okay, I just opened it up, so it's pretty fresh. All right, first of all, which chamber is this?
Isn't that your right
That
ventricle?
would be your right ventricle. How do you know it's the right?
Because the apex is right there.
Because the apex is on the left side,
And you've got like the.
and the walls are
cording.
super thick
Yeah.
on the left side. Okay? How about this chamber here?
Like right.
Note where the valve is. Okay, it's above the
okay.
valve.
Okay. The left atrium.
That would be the left atrium. This one, the left atrium, is pretty hidden. Okay, it's still up in here. So that your left atrium on this side is that one.
Okay.
Okay. What is this floppy ear thing?
Oracle.
Yeah,
That's your
oracle.
oracle. You can see a little bit of the oracle on the other one too. Okay. What? Okay. So if this were the, okay, this is the right side as she said. So we're looking into the right atrium. We don't see these blood vessels, but what two major blood vessels would be coming in here?
Inferior and superior.
Not that's the other side. Superior and inferior vena cava. If we went to the other side, which is the left atrium, then we'd be seeing the pulmonary veins coming in. We do not see them on these hearts. Okay, you're not going to be asked to detect them. They're not here. They're gone. They've been cut away. I'm just getting some orientation. Okay, so what's the name of the ridges of muscle in the atrium? Those are it's pectinate muscle. That's what it looks like. Okay. What about the ridges in the ventricles?
Trabeculate carne.
Yeah. And in terms of trabeculae carne, those are pretty good. We could cut some papillary muscles, but you can see the ridging in the walls pretty clearly. That's all the trabeculae carne in the walls. Okay, Catherine, what's this?
The moderator band.
Yes, and it's part of the conduction system of the heart. It's only in the right side, and it's not prominent like this in humans. So this is a sheep heart only structure, but it's on the right side and it runs from one side to the other. It's called the moderator band. Okay, so what valve? So over on this side, what valve are we passing our fingers through?
Tricuspid.
Yeah, it's our tricuspid. On the other side, that was the bicuspid. Okay, what are these strings that are attached to the valves?
Chordinae tendon.
That's the chordae tendineae. What are those structures they attach to? Those are papillary muscles. Okay, so papillary muscles have chordae tendineae attached to them. So I will make sure, like here is kind of ambiguous. Like, is that a papillary muscle or a trabeculae carne? I could tag them where the strings are coming out, so you know that, oh, that's a papillary muscle, as opposed to some random, thing on the side. Okay, what is this entire midline structure? That's the interventricular septum, and the point is the apex. Okay, how about, let's see how this works. Okay, how about I put my finger in, this wouldn't be on the lab practical with my finger, but I could do it with something else. Okay, that's not where I'm looking. Where am I going? Okay, there. Okay, let's say my finger was a probe. This would work better if I had a probe. I wish I did, actually, but I don't, so we'll just use my finger. Okay, look where it's coming from.
Pulmonary trunk.
It's a pulmonary trunk. Okay, so if you saw, even if you couldn't really see what was going on with this, look at where it's going. Okay, there's only one blood vessel that's going to come out of the right side. That requires you to identify the right side, and then you say, okay, that probe must be going up through the pulmonary trunk. Now, I may have cut it such that we can't. Oh no, that works. Okay. See, here it is hidden here. So if I did the same thing over here, there's your pulmonary trunk in the front. So what's the,
Aorta.
that would be the aorta. And again, I would use a probe where you could see it coming from the right or left ventricle, going up through the blood vessel, and say what blood vessel is it going through. It's going to be either the pulmonary trunk or the aorta. Okay, there's not, people will always put like the superior vena cava. That's not an option in this case. It could be if it were a different heart, but those are totally ripped out. Okay, it's going to be one of those two. And it'll be coming out of the ventricle, and I do it on both sides about interchangeably depending on how I feel like doing it that moment in time. So you shouldn't have trouble with this if it's cut like this, because both of them are very clear as to how they go. That's really it for the heart. I don't think there's too much more. Is there anything else on the list that I didn't get to?
I don't know if you're. Can you see that? No?
For the sheep? For the lamb, I mean? Don't worry about the fossa ovalis or any of that in these guys. Making sure you can tell the two sides apart. The auricles.
Well, the only other thing I'd ask is, are you gonna ask us specifically, like if you have like the probe going through, like what valve is it going through? If you ask us?
Possibly, I wouldn't rule that out. Okay, I wouldn't rule it out. So if it was in here, you should know, okay, so let's do this. If it's coming in through from the right side, what valve is it going through?
Like the pulmonary semi.
Okay, and then let's do this one. Let's just do the two valves here. Okay, and then from the other side, find it. Yeah, somewhere in there
Aortic
is the
semi.
aortic semilunar. What valve got cut here?
The viscous valve?
Yeah, bicuspid.
Bicuspid, yeah.
Okay, and in this case, we could possibly say, okay, what valve is it passing through? Because you can see it's going from the right atrium to the right ventricle. So what valve would that have to be? Tricuspid. That one I could do on the other two, on the models as well, is pass something through it and say what valve is it going through. Not for the pulmonary trunk and aorta because you can't get anything through there. Those are closed, so I could tag the valves closed. But either one I'd be okay with passing something through and saying what valve is going through. So that's, I think, fair game, and that requires you can tell which side is which. I don't intend to do a tricky slice. Okay, you could do something tricky where you cut it from the other side and then those chambers are off. I don't really see any need to do that. I think I'm okay with having it so the right is the right and the left is the left. But even if there was some weird trickiness about it, look at the walls and look at where the apex is. The apex is toward the left, on the left side, and the walls are easily 3 to 4 times thicker on the left than they are on the right. So that'll tell you which side is which. Pectinate muscle is only up in the atrium and in the auricle. That's actually probably inside the auricle, but it's the same muscle. Pectinate is very, very, very ridgy, and trabeculae carnae isn't quite as ridgy, but you can still see it. Okay, are you good? Yes. Okay, last structure, other than Catherine, what's this? The moderator.